Pain, number one. Pain, pain, pain. That's the number 1, 2, and 3 things that really bring patients into our office. But every once in a while, you'll see patients who come in with functional limitations and they don't describe their pain as being so severe. What we like to emphasize, and what many of the primary care doctors and rheumatologists can emphasize for these patients, is medical management. Things like anti-inflammatories, Advil, Aleve, Celebrex, even something such as Tylenol can work, and just pain relief. That's a first-line treatment. Then the other thing is physical therapy and keeping the joints both flexible as much as possible and keeping the strength up about the joints. As the joint continues to deteriorate and the patients continue to have more difficulty and more pain, we can then do things like injections. And then if those continue to not be able to provide that pain relief, that's when you begin to start thinking about hip or knee replacement. Osteoarthritis, the main indication for hip or knee replacement, is basically the cartilage wearing away off the end of the bone. In osteoarthritis, it's just due to sometimes damage over the long life of the joint, whether it be 40, 50, 60 years of wear and tear. Joint replacement is taking out the diseased cartilage and replacing that diseased cartilage with metal, highly cross-linked polyethylene, different inert biomaterials that both take away the pain and restore the function to a knee or hip joint. The hip and knee replacement is one of the best procedures we have in medicine to restore quality of life. And that's what I tell all patients, that it's an elective surgery. It's not an emergent surgery like a heart procedure, but it is there to restore your quality of life. So when you look at the risks and benefits of a hip or knee replacement, the benefits, what I tell all my patients, the benefit is complete pain relief and a restoration of function, getting back that quality of life. The evolution of hip and knee replacement has really come about rapidly over the last 2 to 3 decades. It really now represents one of the most reliable and reproducible procedures in medicine. And we're fortunate at IU Health to be involved in both designing the future generations of hip and knee replacement devices, as well as work on evaluating the existing implants and making sure they're performing at the highest level. And right now we're very fortunate because the advances, if you look at the biomaterials and biomechanics that originally started, we are so far advanced. Now in 2011, it's very safe for us to say, and we've got clinical and lab data to support this, that probably 90 to 95% of patients who get a hip and knee replacement will still have successful, well-functioning hip or knee replacement out 20 years. At IU Health, we can take the patient in any aspect of their disease process, any symptoms they might come with, whether it's the first stages of arthritis or whether they have a hip or knee replacement and they have questions about why it's functioning the way that it is. We can accept the patients into the IU Health family and provide care in a continuum that goes from the very beginning stages all the way through surgical intervention if that's needed, and then help them get their quality of life, restore their function back through physical therapy, through home health, and really have all the support structures that within our system to get those patients back on their feet, get them back to their quality of life that they're looking for.